Good afternoon. So we're here for, I think, a brief update on this March break. There is one new case of COVID-19 to report today in P.E.I, and the case reported is our first case in over a week. This is a male in his 20s who traveled outside of Atlantic, Canada, and he is currently self-isolating. We now have 4 active cases and a total of 144 cases since the pandemic began. To note that 60% of our cases have been in the 20 to 30-year-old age category, and in Canada, there have been over 913,000 cases and 22,500 deaths since the pandemic began. Cases are up 9% in Canada over the last week, which is concerning. There were 56 new outbreaks, which have been reported in the last week across the country, primarily in long-term care and retirement homes. And since the pandemic began, 4,167 outbreaks in long-term care and retirement homes have been reported. The long-range forecast, including variants of concern in terms of the COVID pandemic in Canada, suggests that as a country, the current controls may not be sufficient to contain the more transmissible variants of concern. It is predicted that if the variants continue to spread and replace the existing strains, and if public health control measures remain unchanged, the daily cases in Canada may reach much higher by mid-April. As I've stated before, managing COVID-19 is all about balance. The next few months will continue to be that balancing act, a time of hope and a time of caution, as we try to keep our case counts low enough to allow people to come together and for our economy to function, while we work hard and continue to practice public health measures as we get more islanders vaccinated and achieve herd protection. So as we talk about public health measures, exactly 1 year ago today, Premier King declared a state of public health emergency pursuant to the Public Health Act. And this state of public health emergency is still in place, allowing the office to implement special measures to contain the importation and spread of COVID-19. And I'm sure, I certainly know a year ago, we would never have been able to predict that a public health state of emergency would still be in place in March of 2021. And although the past year has been a very challenging one, which we've talked about, we've all been a part of, we can be proud as individuals and as a province of how well we have managed COVID-19 and how we continue to learn to live with this virus. And I've had a chance to say different times in the last week how fiercely proud I am of P.E.I and of Islanders, and that your actions have saved lives. Last Saturday, public health measures were eased and we moved out of the circuit breaker phase. Thank you to all Islanders, including organizations and businesses, for respecting the circuit breaker measures and for your commitment to keeping our province safe. Thank you to the thousands of Islanders who were tested for COVID-19, and a special note of gratitude to the young people aged 14 to 29 in the Summerside area who took the opportunity to be tested for COVID-19. The circuit breaker measures were effective in breaking the chain of transmission of COVID-19 in our province and allowed the health system to get the outbreak under control. As we have learned from other provinces and countries, the best approach to take when there is a cluster of cases with no connection to travel is to go hard and go fast and implement measures that will limit movement and gathering of people. This approach has worked in other jurisdictions and has been effective yet again here in P.E.I. The new measures that came into effect on Saturday were announced late last week in a news release, and I won't go through all the details, but they are available on the website. Many are wondering about when we will reestablish the Atlantic or maritime bubble, allowing travel between our provinces without having to self-isolate. Like so many Islanders, I hope we can reopen the bubble this spring, possibly as early as next month. And I know our epidemiologists from the region have been meeting, and I know the premiers will be discussing the same thing. Various factors will be considered as we look at easing travel restrictions in the Maritimes. the number of cases per day and the average number of cases over the week, the percentage of non-epi-linked cases, the variants of concern, geographical spread within the region, and the percentage of vulnerable populations who are immunized. In terms of vaccine, our vaccine rollout continues to go well. As of Saturday, almost 16,000 doses of vaccine were administered, including 5,600 second doses. Individuals in congregate living situations, shelters and group homes, adults in Indigenous communities, rotational workers, truck drivers, and healthcare workers with direct patient care, and those over age 80 are currently being immunized. As well, appointments are being made for partners in care, and that continues. And beginning in the next couple of weeks, those over age 75, followed by those over age 70, and Marion will speak more about how to book appointment for those age 70 and over, working back in 5-year increments to those over age 50, along with first responders, police, firefighters, Indigenous adults not vaccinated in the first phase will be immunized. In addition, frontline workers age 18 to 59 will also have the opportunity to be vaccinated, including teachers and school personnel, early childhood educators, public transit drivers, grocery store and retail clerks, restaurant services, gas station attendants, and seafood plant workers. Individuals with underlying medical conditions who are at risk of severe outcomes from COVID-19 and their caregivers will be vaccinated, as well as non-frontline healthcare workers and non-frontline essential workers. And finally, all remaining adults over 18 will be immunized, followed by young people aged 16 and 17 years of age. And in July, starting in July, Islanders will be receiving their second dose of vaccine, and we know a second dose is important and is needed to maintain immunity. And also during the summer, youth age 15 and younger will be immunized depending on if the vaccine is approved for their age group. We have been advised that for the next 8 weeks, the shipment of Pfizer vaccine will increase from 1,170 doses to 4,680 doses per week. In addition, our Moderna vaccine amounts will continue to increase, and they will be delivered every 2 weeks. 2,000 doses of the Covishield, AstraZeneca's COVID-19 vaccine, arrived in P.E.I. last week and have been distributed to 6 community pharmacies across the province to be administered to those 18 to 29 who work in the food and beverage industry and food delivery industry. Effective immediately, young people age 18 to 29 who work in convenience stores, gas stations, and grocery stores can book appointments as well to be immunized at one of the 6 partner pharmacies by visiting princeedwardisland.ca/getthevaccine. We have looked at and we have discussed before that 78% of the outbreaks in P.E.I. have been related to this 18 to 29-year-old age group. And the majority of our cases are also in that particular young age group. So if we want to address the community outbreaks and break the chains of transmission of this virus in the community, we do need to also vaccinate this particular group. And we know very well that an outbreak in one setting impacts everyone in P.E.I. The National Advisory Committee on Immunization now recommends AstraZeneca vaccine not just for those under 64, but also for those over age 65. NACI further recommends the mRNA vaccines be prioritized for those who are the highest risk of severe illness and exposure to COVID-19. There have been reports of some countries suspending the use of the AstraZeneca vaccine as a precautionary measure to investigate reported cases of blood clots. But the World Health Organization indicates there's no evidence these incidents are caused by the vaccine. In Canada, we have a rigorous and effective weekly reporting system to monitor and track any potential adverse effects related to the vaccine. The risk of getting the vaccine is much less than the risk associated with contracting COVID-19. We must remember the goal of our immunization program is to enable as many islanders as possible to be vaccinated as quickly as possible, while ensuring high-risk populations are given priority. As we roll out the vaccine program, population groups will be immunized concurrently, and there will be vaccine for every islander who's eligible and wants one. The best vaccine for each of us is the one that is offered to you first. And everyone who is immunized protects the rest of us. We are awaiting confirmation of when we can expect to receive the recently approved Johnson & Johnson vaccine, the first single-dose product approved in Canada. We are grateful to the thousands of islanders who have stepped up to be immunized against COVID-19 or make their appointments. And as I mentioned, every person who's vaccinated helps the entire population. Thanks to our dedicated and hardworking partners in Health P.E.I, our vaccine rollout is progressing as planned, and we are on track to meet our target of immunizing over 80% of the eligible population over the age of 16 with at least one dose of vaccine by the end of June. This week is a special week for island students, teachers, and school staff. It's March break. And I know everyone in the education system deserves a break to rejuvenate and recharge while keeping their gatherings small and physically distant as possible. We are fortunate in P.E.I that all students in the K-12 system are benefiting from in-class learning this year. This is remarkable achievement given we are all in the midst of a global pandemic. And I know it's not an easy year to be working in the education system, and some of the public health measures are difficult for both students and for staff. Thank you to island teachers and staff across P.E.I for your dedication and commitment to learning and nurturing the young people of our province. As we actually enter year 2 of COVID-19 in P.E.I, we can be grateful for much. We can be grateful all our long-term care and community care residents and staff have had a chance to be vaccinated. We will soon be immunizing upwards of 800 to 1,000 islanders per day with a range of approved and safe vaccines. As I mentioned, our children are benefiting from in-class learning. We are looking forward to reopening the Atlantic or maritime bubble, allowing us to see our family and friends in the region without having to self-isolate. And we are hopeful and anticipating a summer where we welcome more of our family from outside of Atlantic Canada. And I mentioned earlier that hope and caution that we try to combine. So it's that hope for the future as we look forward, as we may ease up on some of these public health measures that we have, but trying to protect our most vulnerable population at the same time. So as we continue this journey with COVID-19, let us continue to be patient and let us continue to be kind. Thank you.
Good afternoon, everyone. As Dr. Morrison mentioned, our vaccine rollout continues to progress smoothly, and it's nice to be here today to speak about the next cohort of vaccine appointments that will become available. Our systems are working well, and we're promoting our online booking system. As yesterday alone, we were able to book more than 2,000 vaccine appointments for people using both our online and telephone system. All individuals aged 75 and older are now able to book their vaccination appointments, as well as our first responders, including police and firefighters. And that's accelerated from what we were able to announce last week because of our systems working so well and people responding to that call. Knowing that our numbers were getting booked more quickly than anticipated, we were able to accelerate those bookings. Appointments, as I mentioned, can be booked directly online using our online booking system, and that's available on the princeedwardisland.ca/getthevaccine site, or by calling 1-844-975-3303 and the booking line to speak to a booking clerk. So today I'm very happy to announce the launch of our next cohort of immunizations for individuals aged 70 to 74. We are dividing this age group, which is larger than the last, by birth month as well. So I would ask that people try and cooperate with the schedule so that we have enough volume for people to use the phone line in particular during this rollout. This will begin next Monday, March 22nd. Individuals age 70 or older, born in the months of January through April, can start booking their appointments. Those age 70 and older, born between the months of May and August, may start booking next Wednesday on March 24th. And those age 70 and older, born between September through December, can start booking their appointments next Friday, March 26th. So just 2 days between each of those call-outs for bookings. Our booking for vaccine appointments continues throughout the month of March for our healthcare workers, the registered rotational workers and truck drivers, our first responders, partners in care, and any other previously identified groups. Additional appointments have been adding during the month of March and April for these groups, and plans are being made for healthcare workers who've not yet received their vaccine appointments to be able to be vaccinated. Information on that process with Health P.E.I. employees will be shared with facility administrators and managers in the coming week. I want to provide an update on our mass vaccination clinics, which also have been accelerated to begin sooner based on the allocation of vaccine we'll receive on P.E.I. Locations for our vaccine clinics are in O'Leary, Summerside, Charlottetown, and Montague, and an additional clinic will be held in Surrey starting in April. We'll continue to monitor the needs in other communities based on the vaccine logistics and our population in those age groups. On Monday, March 29th, is when our mass clinic locations will begin in Charlottetown and Summerside, and they are at 2 different locations from where the clinics are currently being held. So on Monday, March 29th, the Charlottetown clinic will be located at the Eastlink Convention Center, and the Summerside location will be at the Holland College building on Water Street in Summerside. Mass clinics will allow for a larger volume of appointments per day, and these clinic sites in Charlottetown and Summerside are planned for up to 750 appointments per day based on the vaccine availability, and they'll be expanded further if additional vaccine becomes available to us. Our clinics in Montague will remain at the Rosedale Care Center, and the appointment availability has been expanded there. And in O'Leary, it remains at the community hospital. The Surrey clinic will be located at the Surrey Hospital. I wanted to just comment as well, in addition to Dr. Morrison's comments on the availability, now that we have the extended dose, second dose to 16 weeks, that some groups who were originally scheduled for a second dose in March within a 28-day interval will now receive their second dose at the longer interval, and that will be rescheduled. For those individuals who are in the 80 and older age category who had previously scheduled their second dose appointments, your second dose appointment has not changed. All newly scheduled appointments since last week have been done at the 16-week interval. So please remember to come to your vaccine appointments as you book them, and anyone needing to reschedule their appointment can do so by calling the phone line, which is 1-844-975-3303, to speak to our booking clerk to reschedule if necessary. I want to thank everyone, as always, for your patience as we continue with the vaccine rollout. And just to reiterate, there are lots of appointments available for everyone who is being asked to book. You will receive an appointment regardless of when you book online or call for an appointment. So I just want to reassure people that the appointments and doses are there and will be available to you as you call and book. Thank you.
Thank you, Marion. We'll open it up for questions from the media, les questions de nos amis dans le média.
Wayne Thibodeau, CBC. Hi, good afternoon, Dr. Morrison and Marion Dowling. Maybe my first question, if I could, to Dr. Morrison. You mentioned in your opening comments that the current controls that are in place may not be efficient enough to control the new variant. So I guess while a lot of us are expecting an easing of restrictions, there is certainly the potential that we could be going in the other direction. Now, I know the variant hasn't been a big issue here yet, but I wonder if you could speak to that. Is there a good chance that we could be looking at more controls because of what we're seeing in other provinces with the variant?
Hi, Wayne. Good afternoon. So I think I mentioned that because it is something that the whole country is watching very carefully. The percentage of cases that are actually variants of concern is increasing in some of our other provinces. I think now in Ontario, 35–40% of the cases are variants of concern. And over the last week, as I mentioned, the number of cases not continuing to drop in the country. So that combination is always a concern. So it's what we talk about trying to move forward, or so hopeful as we are getting more people vaccinated, but wanting to do so very carefully. And I think if we all of a sudden decided to, release all the public health measures and gather in large numbers and not have people protected and be careful, we would be in a very different situation very quickly. And that is certainly what the modeling is suggesting, and that's what we're cautioning across the country. So, but I'm hopeful. We have done such, an incredible job. Islanders have followed these public health measures over this period of time. I think we all know we want to be somewhere different in a few months and learn to live with COVID differently. But I just want us to go carefully, but with some optimism as well.
Thank you very much. And for my second question, if I could speak with Marion Dowling for just a moment. Marion, you mentioned the mass clinics. Can you tell me, who are these clinics for? Can anyone go when these clinics open on the 29th, or will they still be based on age and certain demographics? And how do people make appointments for these clinics?
Yeah, great question, Wayne. Thank you for that. Because really it's just clarifying that we've been preparing for these mass clinics are our community-based clinics, which are appointment-based. So the appointments that people are booking with our online system are into those clinics. And we have just added clinic appointments based on the availability of additional space and, of course, additional vaccine. And so we're ramping them up into those locations sooner, but they are appointment-based clinics, so they are the clinics that people who booked into Charlottetown for any vaccine appointment as of March 29th or later, it will be at the Eastling Convention Center and not at the Sherwood Business Center. And similarly for Summerside, it's currently at the County Fair Mall. So as of March 29th, if your appointment was booked in the Summerside area after that date, it will now be at the Holland College building in Summerside. And they really allow us the physical space to maintain that distance between individuals who come for their clinic appointments and in their post-vaccination waiting area, where they wait for the 15 minutes after their vaccine to be observed before they're able to carry on.
Thank you both very much for your time this afternoon.
Thank you.
Gabrielle Drummond, Radio-Canada. Good afternoon to you both. Ma question, c'est en français pour la docteure Morrison, parce qu'on sait qu'il y a déjà plus de 5000 personnes qui ont déjà reçu leur deuxième dose du vaccin de la COVID-19 ici à Lille. Alors, pour ces personnes-là, quelles sont les recommandations concernant les voyages? Peut-être cette question a été déjà abordée il y a quelques temps, mais je ne l'avais pas vue. Mais est-ce que ces personnes sont autorisées, les personnes qui ont reçu la deuxième dose, sont autorisées à voyager à l'extérieur de la province, à partir en vacances, par exemple?
Bonjour, Gabriel. Alors, à ce moment, les personnes qui viennent d'avoir le vaccin 1 ou 2 doses, ça change pas à ce moment les mesures de santé publique ou de qu'est-ce qui se passe si vous voyagez. Mais on est en train de discuter comme pays, comme province, et même notre équipe ce matin, de comment on va changer ces mesures après que pas seulement l'individu reçoit un vaccin, mais aussi quand un pourcentage de la population est vaccinée. Alors, ça va changer. On discute comment ça va changer, mais pour l'instant, ça ne change pas beaucoup. Mais j'espère avoir un peu plus de direction et d'avoir une réponse plus concrète dans les semaines qui suivent.
Ok, parfait, merci. Et ma deuxième question, c'est toujours au sujet des vaccins, parce que les gens actuellement, comment ça fonctionne pour faire le contrôle des personnes qui reçoivent la première et la deuxième dose? Est-ce que ces personnes reçoivent un certificat de vaccination? Peut-être ça serait même utile pour plus tard, pour faire de voyages à l'international. Est-ce que vous faites l'émission d'un certificat de vaccination? Comment vous faites le contrôle?
Alors, après que vous recevez votre vaccin, vous pouvez avoir, autant que vous recevez le vaccin, c'est vraiment un papier qui dit vous avez reçu votre nom, la date, quel vaccin. C'est sur un papier officiel qui est, et puis c'est aussi, on est en train de confirmer que ça peut être aussi envoyé par courriel. Et alors, je sais que c'est presque là, mais ça, c'est le plan. Et ça, c'est ce qu'on va faire ici à l'île du Prince-Édouard. Et puis, c'est tout, ça va être toujours là. Si quelqu'un un jour veut s'assurer qu'ils ont un vaccin un jour, ça peut être quelque chose qu'on peut envoyer ou même un jour qu'il peut regarder vous-même pour voir. Alors, c'est pas le même en toutes les provinces, mais ça, c'est qu'est-ce qu'on fait ici. Et je sais, au niveau international, ils sont en train de discuter si on a besoin de quelque chose pour voyager hors du pays, mais à ce moment, c'est pas décidé encore.
Ok, parfait. Merci beaucoup.
Merci. I'll just translate that last question in particular. It was about a record of immunization, and I think we've tried to address it before, but I think it's worth mentioning again that when people are vaccinated, they will receive a printed copy of the record of vaccine, the vaccine they had, the date, your name, on a official piece of paper, but it will also, we're just confirming that it also could hopefully be emailed to an individual as well. And that will be important for those who've already had their vaccine. But that is being, finalized, and that will be a piece of paper that people can have with them. Also, we do have a COVID-19 immunization record so that even 5 years from now, if someone wanted to know what date they were vaccinated on and have confirmation, that will always be available as part of that record. I don't know if you want to add anything to that, Marion, but that's sort of the general plan at the moment. And then nationally, there is part of the discussion around what you might need to have to travel internationally, but that has not been decided yet.
Yeah, no, I think that's quite reflective of what we're putting in place. And so when we have more details about people needing to access that immunization record for their COVID-19 vaccine, we'll be able to provide that to people so they know how to access that record if they haven't received it at their clinic appointment.
Dave Stewart, The Guardian.
Good afternoon, ladies. I guess my first question just deals with someone I was talking to in the food and beverage industry. The person works in the kitchens, just wondering, when you mentioned about vaccinations for those people in the industry, the person was confused over as to whether it just applied to those who had contact with the general public or includes those who work at the back of the restaurant, in the kitchen, for example. So maybe it's just some clarity on that.
Hi, Dave. So I think it's a good question because I don't know if we specified it particularly, but it's that age group who I think, first of all, those in the public who are having interaction with the public certainly priority, but it's really anyone in that food service industry who's in that age group. And that's based on what we know of where the outbreaks have occurred, and also the age group. As I mentioned, the majority of our cases in Prince Edward Island in that age group, and the outbreaks associated with that age group are particularly high in Prince Edward Island. So if someone at the back of the kitchen staff, because they interact with other staff as well. So it's not, they're interacting with other staff as well as may or may not be with the public. So they would be welcome to register for the vaccine through the pharmacy.
Great, thank you very much. And I guess my follow-up question, lots of references to the fact that we're all hoping to get the Atlantic bubble going soon. You said in about a month. Where do you see us a year from now?
I certainly see us, and I'm hopeful that we're talking about COVID more like we talk about influenza, so that it doesn't have the same kind of impacts on our population or any particular group that it does now, and that we are making sure people are continue to be protected against COVID-19, but we'll have be in a different spot so that it's one more communicable disease that is reported to the office, and that we manage, but that it doesn't have this kind of impact on all of us, or unintended impacts on all of us. So that is, and I'm hoping that happens before a year from now, Dave.
Great. Thank you very much, ladies.
Laurent Rigaud, la voix.
Good afternoon to you both. Dr Morrison, bonjour. J'ai une question en français sur le vaccin AstraZeneca. Vous l'avez mentionné en anglais. Est-ce que vous pouvez nous expliquer en français si la vaccination avec ce vaccin va continuer à l'île du Prince-Édouard et au Canada malgré ce qui se passe en Europe?
Bonjour. Alors ici au Canada, on n'a pas de raison d'arrêter de faire les vaccins avec AstraZeneca. En Europe, on a des millions de vaccins AstraZeneca qui ont été donnés, et je pense que c'était 33 ou 37 cas qui sont eu des blood clots, et mais quand ils ont regardé, c'était pas plus que normal, vraiment. Ils pensent pas que c'est lié au vaccin. Alors, on a un système ici au Canada. Si on voit quelque chose avec on s'appelle ça en anglais AFEs, Adverse Events Following Immunization, et puis tout le monde, toutes les provinces et territoires, on travaille ensemble pour regarder ces événements. Et puis, s'ils voient quelque chose, ils vont regarder, faire une pause et regarder si c'est lié. Mais à ce moment, on va continuer. On ne voit pas de problème. Il y a des millions de personnes autour du monde qui ont eu AstraZeneca. Mais si quelque chose change, on va avoir notre direction. Et puis l'AstraZeneca qu'on a ici au Canada, c'est pas même quand ils ont utilisé en Europe. I think there may be a little technical issue here, so we're just trying to fix that on the phone line. So I'll just.
Hello?
Hello.
Hello?
Hello. Laurent, is that you?
Oui.
Oui. OK.
Il y a une petite coupure, pardon.
Non. Est-ce que vous m'avez entendu?
Oui,
Ok.
j'ai entendu.
OK, merci.
J'avais juste une autre question sur quelque chose que vous avez dit en anglais. Vous avez expliqué qu'à cause des variants, les restrictions, enfin les mesures de santé publique pourraient ne pas être suffisantes au Canada, qu'on pourrait voir un pic en avril à cause des variants si on ne fait pas plus attention. Est-ce que ça va avoir un impact ici à l'île du Prince-Édouard ou est-ce que ça ne nous concerne pas?
On regarde, on fait attention à ce qui arrive au Canada. Et puis, on sait que si on laisse tout aller, on ne suit pas les mesures de santé publique, on va avoir bien plus de cas de variants. Et alors, ça nous inquiète un peu, mais j'espère qu'ici, si on va aller suivre lentement et puis avec une mesure de caution, vraiment, on va faire attention et j'espère que ça va pas, on doit pas changer les mesures ici. J'espère qu'on peut faire beaucoup plus de vaccins et puis à un moment, on va avoir les mesures qui sont pas aussi strictes de santé publique ici à l'île du Prince-Édouard, mais en même temps, on fait attention parce que si on a beaucoup de cas ailleurs, ça peut avoir un impact ici parce qu'on ne veut pas que ça rentre ici et on a beaucoup de cas.
Merci beaucoup.
Okay.
Bonne journée.
Bonne journée.
Héloïse Rodriguez, Radio-Canada.
Oui, bonjour, Dr. Morrison. Pour continuer sur le vaccin AstraZeneca, maintenant que c'est recommandé pour les personnes âgées de 65 ans et plus, pourquoi ne pas commencer par ce groupe-là pour ce vaccin?
Bonjour. Alors, on vient d'annoncer de plus en plus vaccins mRNA avec Pfizer et Moderna. Alors, la majorité de notre vaccin est comme 92 vaccins de mRNA, on va avoir au moins jusqu'avant la fin de juin. Et puis, on a seulement un petit nombre vraiment de AstraZeneca. Alors, on a 2000 doses à ce moment, peut-être un peu plus en avril. Alors, on regarde notre épidémiologie, qu'à ce moment, c'est important de faire les personnes qui sont plus âgées, mais en même temps de s'assurer qu'on n'a pas des outbreaks avec les groupes qui sont plus jeunes, parce que ça nous impacte. Et puis, si on protège tout le monde, si on peut protéger le risque avec les plus jeunes aussi. Alors, avec seulement 2000 doses, on n'a pas beaucoup et on doit utiliser en même temps qu'on essaie de faire les vaccins avec toutes les personnes qui sont plus âgées.
Merci.
Okay.
Et ma question de suivi, juste pour résumer, pour les personnes qui s'inquiètent de recevoir ce vaccin qui est seulement 60% d'efficacité, qu'est-ce que vous leur répondez? Est-ce que vous auriez confiance de recevoir ce vaccin-là?
Oui, j'ai dit en anglais, puis je sais que le premier ministre dit ça aussi, que le meilleur vaccin est le vaccin le meilleur vaccin d'avoir est le vaccin qui est présenté. Et alors, je serais content pour avoir n'importe quel vaccin. Et c'est pas mon tour encore, mais quand c'est mon tour, je serais content de recevoir n'importe quel vaccin. Et puis, mais je sais qu'il y a les personnes qui sont aux soins de longue durée, et puis c'est recommandé qu'ils reçoivent le mRNA vaccine. Mais à part, et puis il y a certains groupes, mais si vous êtes en bonne santé, vous pouvez recevoir n'importe quel.
Merci.
OK, merci.
Bruce Frisco, CPV Halifax.
Hey, Dr. Morrison, with the 8 new cases announced throughout the Maritimes today, we're sitting somewhere around, I think, 62 active cases around here, which is about a third of what we had when the Atlantic bubble effectively collapsed last fall. I'm wondering, what would it take, in your mind, to reopen the bubble?
Hi, well, I think it's, we mentioned the different triggers that we would look at, and that is not, so it's not just the number of cases, it's looking at whether the percentage of cases that are epi-linked or not epi-linked, looking at the numbers of cases that are variants of concern and what the geographical spread is, whether they're travel related or not, and what kind of measures are put in place in each of our respective provinces. We've also talked about trying to make sure that our certain vulnerable groups are immunized. For instance, we all want to make sure, I know that our long-term care facilities and community care facilities can be vaccinated to a high percentage before there would be consideration of maritime bubble. So those are the factors that our epidemiologists are certainly looking at. They're the same kind of triggers that I know our Atlantic Chief Medical Officers Health will be discussing and have discussed, and the same kind of conversations would happen with the premiers.
Yeah, and that conversation, we understand, is going to happen tomorrow. And as I'm sure you know, as you've acknowledged, a lot of Maritimers are just anxious to get this up and running again. Just some extra freedoms, even if it was just for the early part of the summer. Do you see that happening? You mentioned next month. Is that realistic right now, or will it be later before we can travel regionally?
I think I know I've heard Dr. Strang say this in Nova Scotia too, that it's really hard to look out too far, and we sort of almost want to do it two to 4 weeks at a time. So it's very, we all have learned, all of us in Atlantic Canada, how quickly it can change. But certainly it is our hope as we get more people vaccinated in the next month, and we look at these triggers and we take the best advice we can, that we're able to do so. So I am hopeful, but I also know that it can change as well. I mean, when you look, we had 5 months of the Atlantic bubble, and it really was a success in so many ways. And as a region, we have done so well. When we look at the number of cases per 100,000 population in the rest of Canada versus our number of cases per 100,000 in each of our respective Atlantic provinces, we're so much lower than it is. And I think, so the Canadian rate is 2,402 cases per 100,000 population, and each of our provinces is less than 200 cases per 100,000 population. So as a region, we have done well. We're certainly continuing to do well, and hopeful that we can have a bubble, but do so cautiously, watching what is going on around the country and in our own region.
Appreciate the answer. Thank you, ladies.
Thanks.
Jessica Doria Brown, CBC.
Hi, Dr. Morrison. My question is about the AstraZeneca vaccine. I know you've said and others have said the best vaccine is the one that's offered to you first, but all the same, some hesitation remains around that one. Are there any instances or circumstances where islanders will be given an option, and what will happen if somebody wants a COVID-19 vaccine but not that vaccine, or will the focus be on educating and alleviating the fears of people who are apprehensive about that one in particular?
Well, Jessica, I think both. I think there's certainly the education will be and reassuring will be part of it, but also, as we mentioned, the majority of the vaccine that's coming into this province is the mRNA vaccines, the 2 Pfizer, Moderna, by far the bulk of the vaccine. I think between the 1st of April and the end of June, we expect over 92,000 doses of the mRNA vaccine and maybe 8,000 doses of the AstraZeneca. So it's certainly much more likely that people will have the mRNA vaccine offered to them. But we know there have been millions of people around the world who've received the AstraZeneca vaccine. The AstraZeneca vaccine is demonstrating not just in trials but in real data that it reduces moderate to severe illness in anyone who has COVID-19. So it's, I think we'll be doing both. I think if someone, didn't want to take it, we would certainly do some, education around it, but they would have a chance to get the mRNA vaccine if they needed to.
Okay, thank you. And for my second question, just as the province is getting set up for these mass vaccination clinics, what work is being done to protect people's privacy, just with computer networks being set up in places like the Eastlink Centre?
Let Marion address some of these bigger clinics.
Sure. Thanks, Jessica. Well, we have the clinics will be all set up and have been set up and wired into our internal health network. So IT shared services with the province has been exceptional to support our clinics, both at our testing sites and now at our vaccine clinics as well. So those are set up within our health network system. So it's a secure system for individuals to be working from.
Okay, and just a quick clarification. I know these mass vaccination clinics were supposed to start next week, and they're going to start just a few days later the following week. Is the delay due to setting up a VPN?
No, I think they actually weren't due to be set up until April, so I think there just may have been some incorrect information that was perhaps sent on about the clinics. Actually, beginning the March 29th is a full week sooner than we were anticipating, if not 2 weeks sooner than we thought we would have enough doses to be able to start the clinics. So we're starting them in an accelerated way, and the 29th is when we're ready to go. The Eastlink Centre has already been wired to our network because, of course, we were there with our earlier initial setup with our testing sites and our cough and fever clinics. So they were all working within our internal health network as well. So that wiring is done, and IT Shared Services is working on the Holland College location now.
Okay, thanks for the clarification.
You're welcome.
I think that's it. So thank you, Marion. Thank you, everyone, and enjoy the rest of the March break.